Pylephlebitis as a complication of diverticulitis. Definition: Pylephlebitis is an inflamed thrombosis of the portal vein. It is a rare complication of an intra-abdominal infection, and the diagnosis is often missed due to its non-specific clinical presentation. Symptoms may include abdominal pain, fever, chills, fatigue, nausea, and vomiting. It is important to consider this differential when a patient presents with signs of abdominal sepsis, since it is a high mortality rate and is often diagnosed post-mortem.
Pylephlebitis, also called pylophlebitis and infective suppurative thrombosis of the portal vein, is an uncommon thrombophlebitis of the portal vein or any of its branches, i.e. a portal vein thrombosis, that is caused by infection. It is usually a complication of intra-abdominal sepsis, most often following diverticulitis, perforated appendicitis, or peritonitis. Considered uniformly lethal in the pre-antibiotic era, it still carries a mortality of 10 to 30%. It typically presents with fever, rigors, and right upper quadrant abdominal pain, but sometimes abdominal pain may be absent. Liver function test abnormalities are usually present, but frank jaundice is uncommon. In the modern era, it is usually diagnosed by CT scans of the abdomen and pelvis. Bacteriology is often polymicrobial and blood cultures are positive in some cases. A significant fraction of people presenting with this condition have an underlying hypercoagulable state. Treatment is with a prolonged course of broad-spectrum antibiotics, with the addition of anticoagulants if other clots are present outside the portal vein or if fever persists on antibiotic therapy.
Application in medicine. A 56-year-old African-American male presented to the emergency room with a chief complaint of fever, chills, and weakness. The patient also reported experiencing dizziness, headache, and decreased appetite. The patient's past medical history includes diabetes mellitus type 2, hypertension, hyperlipidemia, cellulitis, and deep venous thrombosis (DVT), treated with enoxaparin for 6 months. An abdominal and pelvic CT scan was completed to rule out the possibility of appendicitis, diverticulitis, or an intra-abdominal abscess. The CT revealed a non-occlusive thrombus within the main portal vein that extended throughout the superior mesenteric vein. Also was discovered 3.2 cm mass concerning of appendicitis or fatty infarct in the ileocecal region.
Abdominal pain. Now, abdominal pain is a broad subject, but if someone is concerned about a specific disease such as diverticulitis, the pain usually is acute. More often than not, it is a pain centered to the lower abdomen. More commonly than not, the left side of the abdomen. We call it the left lower abdominal quadrant. That is an area where most of the diverticuli usually occur. It's an area where the bowel is somewhat narrow and a little curved. And when diverticulitis occurs, develops, that means inflammation within the diverticula, the pain will be or can be quite severe. It can also be mild. Patients may develop a change in the bowel pattern. They may become constipated. They can't eliminate the stools as well. They may feel bloated. Sometimes the pain is quite intense and the patient is doubled over. Sometimes the patient can have a fever with chills, a sign of infection. What diverticulitis really is, the definition, is a perforation. That means a little hole, small, doesn't have to be large, in one of the diverticuli or in several diverticuli. So in the space, the area of the colon where these are located, things become narrow, swollen, we call it edema. Pus can collect, and that is called abscess, and therefore patients can be quite ill. They need to be seen promptly. Many cases of diverticulitis tend to be mild in the sense that the patient can be seen by the physician as an outpatient, evaluated, diagnosis established, and be treated with antibiotics. The specific way to make the diagnosis is not only the clinical presentation, the clinical findings, is the need to do an X-ray, a CT scan with contrast of the abdomen, focusing in the area where the pain is present. Now, that doesn't mean that you cannot have diverticulitis in other segments of the colon. It could be at the right side, it could be in the mid-portion colon, transverse colon. But as I said previously, the left side of the colon, the sigmoid colon, is the predominant site where diverticulitis develops. But abdominal pain is a broad symptom. It's caused by many conditions. So it's important for the physician to know how to proceed and differentiate what we call establish a differential diagnosis for other conditions. It could be a catastrophe, something is leaking into the abdomen. There could be another abscess. There could be a perforated appendix, and so on. So that's why prompt evaluation, the proper X-ray studies, and laboratory studies as well, and then proceed with the treatment and follow.
Hi, it's Mike from BetterDigestion.org. Today I'm going to share with you the top 3 ways to prevent diverticulitis attacks. Stay tuned. At the end of this report, I'm going to show you a free download titled The Top 10 Gut Cleansing Foods. It'll help you improve your digestive health and feel better almost immediately. If you want to learn more about that now, click on the link on your screen or in the description. So, diverticulitis. Diverticulitis is an infection or inflammation in the diverticula that happens when feces gets trapped in the digestive system. So it's painful, it's a direct result of lifestyle choices, and I want to show you the top 3 ways to prevent diverticulitis attacks. So the first thing you can do is eat more fiber. And as you probably know, fiber is an essential part of a healthy diet. It helps rid the body of bulk waste that can get caught in the diverticula, and that can trigger the attack that we're talking about today. Many doctors and healthcare professionals recommend a gradual increase in fiber. So don't just go, loading up on fiber right away. Gradually increase your fiber intake. That'll help avoid abdominal issues, digestive distress, gas, bloating, etc. Adding more whole grains, fresh fruits, and vegetables can really help prevent a painful diverticulitis attack. There are many supplements or powders on the market. Really look to supplement with all natural foods to improve your digestive health. The second way you can prevent diverticulitis attacks is to increase your water intake. And staying hydrated is important for everyone. It's especially important for people who tend to suffer from digestive issues. Consuming high fiber foods, your need for water increases even more. Drinking water with fiber-rich foods helps pass the waste through your system more easily. Soluble fiber like apples, beans, oranges, and oatmeal tend to dissolve in water, and they help you feel fuller longer. So those are the things that can help you prevent you from snacking midday and binge eating. Insoluble fiber like whole grain breads and rice, broccoli, or green leafy vegetables.
Pros and cons. Pros. There should be a high clinical suspicion in patients who present with abdominal pain, fever, or other signs of sepsis, as well as leukocytes and elevated liver enzymes. Pylephlebitis can be diagnosed via abdominal ultrasonography, showing a thrombus in a portal vein. Cons. Pylephlebitis occurs as a result of an abdominal infection draining into the portal venous system. The infection is usually polymicrobial, and Bacteroides fragilis is the most commonly isolated organism. The symptoms of pylephlebitis are non-specific, and the condition is potentially lethal.
Hi, this is Dr. Joe Galati, and we're going to be talking about diverticulosis in this video clip. And this is a very common abnormality that we see at the time of colonoscopy. And in this particular case, this was a 50-year-old gentleman who was going for screening colonoscopy and had some vague left lower-sided pain. And as you can see here, most of his entire lower colon was full of these diverticuli, which are these outpouchings in the lower colon. It's a very common problem. Up to half the patients over 60 years old have diverticulosis. Now, many times you may have absolutely no symptoms. Other times you may have some vague abdominal pain, some bloating, and some discomfort and constipation. Certainly you could have more complications related to diverticulosis, which is diverticulitis, which is infection of the colon, which can lead to serious complications, including abscess formation, perforation, and the need for surgery, and this would be considered a medical emergency. But certainly this is a good illustration of diverticuli. The remedy would be to increase your dietary fiber. We like to say between 35 to 40 grams of fiber per day, and certainly reduce the amount of processed foods. As always, for more information,
Issue plan in Ecuador. In Ecuador, you can make an accurate diagnosis through the use of new methods of diagnosis like abdominal tomography, color Doppler, ultrasound, and CT of abdomen. In a patient of Diverticulitis hospital was performed abdominal ultrasound, hepatosplenomegaly seen, presence of material ectogenic in the portal system that does not rule out the possibility of small occlusive thrombus. Abdominal CT objectifies hepatosplenomegaly, bilateral pleural effusion, ascites and signs of peripheral vein thrombosis. Echo Doppler, finding an enlarged liver, altered ecotexture, intrahepatic veins dilated, superior mesenteric vein with abundant turbulent waves, which increase the flow, portal vein long and no flow inside. Abdominal Doppler ego control, where a good flow and portal vein seen absence of cholesterol with normal hepatic ecostructure.
Hi, my name is George McKenzie, and I'm not a doctor, but I had my first colonoscopy recently, and my doctor said I had some signs of diverticulosis. Now, I have a background as a medical reporter, so I knew what he was talking about. Most people, however, probably wouldn't. So I've created this video to explain what diverticulosis is and how to know if you might have it. Diverticulosis is a condition in which small pouches grow in the lining of the colon and sometimes begin to bulge through the colon wall. A single pouch is called a diverticulum. The plural word is diverticula. Diverticulosis is therefore known as a diverticular disease. In 10 to 25% of cases, diverticulosis precedes a similar condition called diverticulitis. This disorder occurs when diverticula become inflamed. Let's take a look at some of the possible causes of diverticulosis. Although conclusive evidence is lacking, it appears diverticulosis may result from the lack of fiber in the patient's diet. Researchers have noticed that diverticular diseases became much more prevalent in the U.S. early in the 20th century when processed foods became more common. Processed foods generally have less fiber. The more processed foods you eat, the less fiber you get. Diverticular disease is also more common in developed or industrialized countries, which adds credence to the theory that low-fiber diets promote diverticulosis and diverticulitis. Diverticular disease is rare in Asia and Africa, where people generally eat a lot more fiber. Symptoms of diverticulosis. Those who have diverticulosis generally don't experience any discomfort or symptoms. Occasionally, however, there could be mild cramping, bloating, and constipation. You should note, however, that some other problems like stomach ulcers and irritable bowel syndrome or IBS present similar symptoms, so diagnosis is not always that easy. Treating diverticulosis. Lifestyle changes are usually the best treatment for diverticulosis. Adding more fiber to the diet reduces diverticular problems, although mild pain medications may be prescribed in certain cases where abdominal pain or discomfort is present.